So it's a survivorship program that we started to help address patients that were not being captured early in the lymphedema process. And what happens is once somebody develops lymphedema, it becomes chronic. So the earlier you can capture the lymphedema, the better off the patient is. And so by the preclinical, by definition, we're trying to capture people before they actually have to see a licensed therapist for treatment. So we are providing them with education, and that's the biggest focus, as well as self-care behaviors. Exercise, weight management. We like to say it's all the things you learned in kindergarten that keep you healthy. So we did the SWOT analysis and we looked at our strengths, weaknesses, opportunities, and either you want to look at as threats or that's kind of a harsh word, but what we found was that we were lucky enough to have 3 CLTs, or certified lymphedema therapists, but they were still overwhelmed with seeing patients because it is a time-consuming process to do the wrapping or the therapeutic massage. And so we looked for strengths that would be like having the therapist. Opportunities were we didn't have a way of really identifying the patients that were at greatest risk. So we developed a risk tool which helps us tell a patient proactively, are you a low risk, a moderate risk, or a high risk patient? And then they can practice self behaviors. And so that was our way of addressing it by looking at it through that SWOT analysis of saying, okay, this isn't something that's resource intense, especially if we can catch it early. So I think the biggest advice is that a lot of people are afraid of the cost associated with starting new programs. And one of the benefits of this is that it can be run by a nurse or a CLT if you have one that has the bandwidth. Or it can be even somebody who is certified to do measurements for the compression devices and the mastectomy bras. A lot of them have the same skill sets. So it's a relatively inexpensive project to run. It is self-directed by the patient because it's either a written or a video process, and so they can access it 24/7 via a site. It doesn't have to be maintained or monitored. It's available on any smart device, so it really is accessible, low cost to implement. But even if your organization is looking at, well, how are we going to offset the cost of that person's time, it is a billable service for clinicians because it's considered an educational conversation.